my name is Kathleen Colonna-Marique, and I am a professor of medicine at Duke University and the associate director at the Durham VA Geriatric Research Education and Clinical Center. Our article, Limited Osteoporosis Screening of Effectiveness Due to Low Treatment Rates in a National Sample of Older Men, will be appearing in Mayo Clinic Proceedings. Osteoporosis is a weakening of the bones that occurs in many older adults and can lead to painful and debilitating bone fractures. Doctors can screen patients for osteoporosis with a bone density test and use medications to strengthen their bones and prevent fractures. However, it is not known how well screening works in a real-world healthcare setting, especially for men. So we looked at medical information for over 4 million men receiving primary care in the VA over a 10-year period to see if osteoporosis screening was preventing fractures. We found that overall, VA's osteoporosis screening practices did not prevent fractures in men. Reasons for this included not selecting the right men for screening and not ensuring that men took osteoporosis medications for long enough to benefit. However, we found that men with additional fracture risk factors and men over age 80 years did benefit from screening with fewer fractures compared to similar men. We believe that these findings are important for several reasons. First, there's been very limited information to help men and their doctors decide whether or not to undergo osteoporosis screening with a bone density test. This study indicates that screening and treatment does help men with higher fracture risk. We suggest that men over age 65 who have chronic conditions like lung disease, kidney disease, liver disease, diabetes, and neurologic conditions should talk with their doctors about osteoporosis screening. Second, the study shows the VA and other large health systems that they need to put additional interventions in place to improve fracture prevention programs. Patients and primary care providers need more support in making screening and long-term osteoporosis treatment work. Our group is now beginning to study 2 new models of screening. One using a practice management approach with support from nursing and pharmacy, and a second approach in which a centralized bone health team is responsible for organizing screening across the whole region. We hope to show that one or both of these models reduce the risk of fractures in men.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.